All right, let's get right into it. We're going to talk about a totally new way to think about blood pressure, and more importantly, what those numbers on the cuff aren't telling you. I want you to just imagine this for a second. You're a cardiac surgeon, and you're holding the artery of a 72-year-old man. It's supposed to be soft, flexible, alive, but instead, when you try to put a needle in, it crunches. That's the exact jarring experience Dr. Claire Whitmore had. It wasn't just hard. She said it was like trying to sew through an eggshell.
Now, here's where it gets really interesting, because this slide shows this massive disconnect. On paper, on his chart, this guy was a success story. His blood pressure was a nice, tidy 128/82. He was on 3 different medications. His doctor was probably thrilled. But the reality, what the surgeon was actually holding in her hands, was an artery that had turned to concrete. The numbers looked good, but the actual disease inside was getting worse.
And this isn't just some one-off story, not by a long shot. A huge study in 2023 in a top cardiology journal basically confirmed this terrifying truth. They followed over 47,000 people and found that patients whose blood pressure was controlled with meds had almost the exact same risk of heart attack and stroke as people whose blood pressure was completely uncontrolled. The pills were pushing the numbers down, sure, but the damage to the arteries was just continuing in the background. So this leads us to the question that we really should be asking but often aren't. What if, instead of just playing whack-a-mole with a number, you could actually reverse the root cause of the problem? Not just control it, what if you could actually heal the arteries themselves? Well, that's exactly what we're going to dive into. We'll talk about this illusion of control, and then we'll break down 7 evidence-based protocols that go way beyond medication. We're talking simple things like hand grips and breathing, all the way to repairing your artery linings, getting rid of calcium, and even using specific foods, and then we'll put it all together in an action plan. Okay, let's jump into our first set of protocols. We're going to count them down from 7, starting with 2 habits that are so simple you might not believe how big of an impact they can have. So here we go. Protocol number 7, isometric hand grip training. Now get this. A massive review of studies in 2024 found that this specific exercise is actually better at lowering blood pressure than aerobics or even lifting weights. It's a total game changer, and almost nobody's talking about it. And the results are just wow. An average drop of over 11 points in that top number, the systolic pressure. That's basically the same effect as adding a whole second blood pressure pill, but with 0 side effects. So how does it work? Well, when you squeeze, you clamp down on the blood vessels in your arm. Then when you let go, blood rushes back in, creating this friction called shear stress. That friction is a signal to your artery walls to pump out more nitric oxide, which is your body's own natural, built-in vessel relaxer. And the great thing is, this isn't vague advice. It is a very specific protocol. A retired firefighter, James Patterson, followed these exact steps. You figure out your maximum squeeze, then you do 4 sets of 2-minute squeezes at just 30% of that max, with a minute of rest in between. That's it. He did that just 3 times a week, and in 4 months, he went from needing 3 medications down to just 1. All right, next up, protocol number 6 is, believe it or not, even simpler. It's just nasal breathing. I know, it sounds way too basic to be a big deal, but the science here is just incredible. The problem is, a huge number of us, especially as we get older, are chronic mouth breathers, especially when we sleep, and we're missing out on a massive free benefit. And this chart right here shows you why. Just by breathing through your nose instead of your mouth, you can increase the nitric oxide in your system by up to 600%. Your sinuses are a little nitric oxide factory. That gas gets into your bloodstream and relaxes your blood vessels everywhere. The fix for this is almost laughably simple. A little bit of medical tape over your lips at night. It forces you to nose breathe and get all that benefit while you sleep. Okay, let's move on to the next 2 protocols. These are focused on rebuilding the actual physical structure of your blood vessels. We're talking about repairing their protective inner coating and literally removing the calcium that's making them stiff. Protocol number 5 is all about something called the glycocalyx. Now, you've probably never heard of it, but just think of it like a microscopic, non-stick Teflon coating inside all of your arteries. It keeps things slick, it blocks cholesterol from sticking, and it helps the vessels relax. The number 1 enemy of this delicate lining? High blood sugar. But the good news is, research shows you can help repair it by getting your blood sugar stable and using specific compounds, like one called fucodinin, which comes from brown seaweed. And this isn't just theory. Look at this real-world example of Thomas Chen, a 70-year-old engineer.
His vessel function, basically how well his arteries could relax, was at a dismal 4%. That's severe damage. But by focusing on rebuilding his glycocalyx, he got back to a normal 12% in just 3 months. And after 6 months, he was completely off his blood pressure meds.
Now for protocol number 4, arterial decalcification. Over the years, calcium can literally build up in your artery walls, turning those flexible hoses into stiff, rigid pipes. This is a huge reason why that top blood pressure number starts to creep up, and it's a major risk for strokes. So how do you get it out of there? Well, the key is this protein called MGP. And I love this quote because it describes its job perfectly. It's a traffic cop for calcium. It's supposed to direct calcium into your bones. The problem is, for this traffic cop to even show up for work, it has to be activated by vitamin K2. Most of us don't get enough K2, so the MGP is dormant, and calcium just wanders into our artery walls where it causes all kinds of trouble.
And here's the crucial part. It's a team effort. You need what we call the decalcification trio, 3 nutrients that most people are low in. Vitamin K2 wakes up the traffic cop protein. Vitamin D3 is essential for overall calcium balance. And magnesium acts like a bouncer, helping to prevent new calcium from getting into the arteries in the first place. These 3 work together to gently guide calcium out of your soft tissues and back into your bones.
All right, let's explore the final 3 protocols. These are all about powerful strategies you can use with your diet. We're going to look at what you eat, when you eat, and one very specific food that is an absolute superstar.
So let's run through these quickly. Protocol number 3 is natto. It's a fermented soybean food from Japan. This stuff is a powerhouse. It's got an enzyme called nattokinase that can actually dissolve blood clots, and it's the single richest food source of that vitamin K2 we were just talking about. Protocol number 2, time-restricted eating. This is super simple. By just eating at a smaller window of time, say 8 hours a day, you lower your insulin. When insulin is low, your kidneys can finally do their job properly and get rid of excess sodium, which can directly lower your blood pressure. And finally, protocol number 1 is all about polyphenols. Think of these as bodyguards. They're compounds in foods like berries, dark chocolate, and green tea that protect the special enzyme in your vessels that makes all that wonderful nitric oxide.
And this chart really just brings it all home. This shows you what can happen when you start combining these strategies. This is the story of Susan Park, a 66-year-old who put all 7 of these protocols into practice. A year later, look at this. Her blood pressure dropped from 134/84 to 115/72. She went from 3 medications down to 0. Her arterial stiffness improved, and her endothelial function, that ability of her vessels to relax, nearly tripled. Her blood vessels were literally acting younger.
Okay, I know we've covered a ton of ground here. So let's take all this knowledge and distill it down into a practical, step-by-step plan that you can actually start with. No overwhelm.
So here's a quick cheat sheet of everything we talked about. You can see how each protocol hits a different target. Some boost nitric oxide, some repair the artery lining, some remove calcium. And it's a mix of simple exercises, new habits, and food-based approaches.
But please, do not try to do all of this at once. The key is to start simple. In week 1, just focus on the 2 easiest, freest things, taping your mouth at night and doing the hand grips. That's it. Then, over the next few weeks and months, you can slowly layer in the other protocols. It's not about being perfect tomorrow. It's about being consistent over time.
So, the real takeaway here is this. A blood pressure diagnosis does not have to be a life sentence on medication. You are not powerless in this situation. You now understand the mechanisms that are actually going on under the surface, things like the glycocalyx and nitric oxide that frankly even many doctors don't focus on. You have the knowledge now. What you do with it, well, that choice is yours.